please give some context as to what is a stereotype threat?
Yes, I think we all know what it is and have all experienced it, and stereotype threat is just a fancy way of describing it. But what the word is describing is two things. Stereotype is a belief about a group, usually not necessarily a person. And stereotypes can be positive or negative. But in this particular discussion, we're talking about the power of negative stereotypes. So we learn about our social identities as we develop, and we know what stereotypes are associated with our particular groups. We learn that from watching TV. We learn it from having interactions with family and friends. We might learn it in our actual development as a professional. For example, in medicine, we've learned stereotypes about particular patient groups. So we know those are present. And when we enter into a space, we may not be thinking about any of these stereotypes at all until there's a cue in the environment that activates our thinking about that stereotype. And now that we're thinking about it, we're most worried about actually proving that stereotype to be true. So we're really preoccupied with the fact that that stereotype exists and it could be associated with us, but also that the person that we're talking to or the group of people that we're talking to, that we're going to prove that stereotype is actually true. And that's a tough thing to be thinking about because, again, these are negative stereotypes. So because we're focused on that, our thinking slows down and we're not able to process as much information. We feel things in our bodies, we get sweaty, our heart rate might increase, we feel very uncomfortable. And those are distracting things to feel and think. So in a healthcare setting, when we talk about stereotype threat and how risky it is, it basically means that you as a patient may not be able to participate fully in your care. You may not be able to ask questions that you should have asked based on what your interests were in having the visit in the first place. You might not be able to receive information from your doctor as easily because you're very preoccupied by this threat. And then your doctor may not be responsive to the fact that you're actually thinking and feeling these things. So there's a mismatch there in the communication. So we know a lot of talking with doctors and patients about transmitting information. So stereotype threat in the healthcare setting is particularly important for us to be thinking about.